excuse me, Madison, Minnesota, not Madison, Wisconsin. Madison, Wisconsin's entitled to call in too. We're happy to talk to problems, particularly greater Minnesota. This viewer is concerned about regulations that are placed on daycare providers, and the viewer is convinced. The viewer is asking the legislators about the issue that regulations actually make it difficult to get daycare services into greater Minnesota. So let's start. I'm sure that issue is more than just affecting more than just um, rural Minnesota. Let's start with you, Representative Long. Daycare providers, what can you help us? What can you tell us about that issue?
Sure. Well, I'm taking daycare to mean childcare, early childhood.
Right.
Um, so the I have two small kids, and I know the childcare system well, and I think this is a concern that those in urban Minnesota, those in suburban Minnesota, those in greater Minnesota all share, which is affordability and availability of high quality childcare. I've heard that from my colleagues all over the state, and it's certainly going to be a high priority for us. In Minnesota, we have some of the highest average childcare costs of any state. And right now, the average childcare cost for pre-K is the same as first year tuition in the University of Minnesota. And we're asking families to pay that at a time when they're earlier in their earning potential, when they are just getting started, rather than for college where you're encouraged to save for 18 years, right? So that's been a huge impact on our workforce, on our ability for people to get back into work. A lot of individuals cite that as the number one reason why they're still home, why we don't have a higher workforce participation rate. So this is a huge problem and really needs big solutions. And it's something that we're going to take very seriously. One thing is that the business model for childcare is really broken. We don't pay providers enough. We don't pay the teachers, the individuals who are in early childhood classrooms enough, and it's very hard to make that work. So we proposed in one of our early priorities moving the reimbursement rates up for providers to make sure that they are getting more help in getting better reimbursement to be able to have more opportunities. We also are going to be looking at many of the models that are out there for providing early childhood, trying to provide support for scholarships, for learning in school settings. There's a lot of different opportunities we have, but we know that we need to tackle this and we need to approach it early. In terms of the question on regulation, it's certainly something I've heard about from some childcare providers. We do want to make sure that our childcare is safe, and we want to make sure that it's high quality. I'm certainly open to suggestions on specific changes that could be made in our childcare setting, but I think the finance is the biggest problem for our early childhood settings, and we just don't have a sustainable funding model, and putting it on the backs of parents is not working.
Representative Nash, your thoughts?
Yeah, thanks, Barry. I would say that the question is asked on regulations, and coming from the private sector, regulations will eventually drive up the cost of things that are getting passed on to the people who are consuming the product, whether it's daycare or something else. And I think we have to look very long and hard at the requirements that we're placing on people who are the providers of this very valuable service, and ask, are we regulating people out of the ability to afford the service that we claim that they need the most? Um, our family was very fortunate to, my wife stayed home for a good portion of our six kids child rearing days. That's not always possible for everybody, and I certainly understand that. But when we look fundamentally at what are the cost inputs, thinking as from an economic perspective, if you look at the inputs that are going into the service that's being created, regulation drives compliance. Compliance has to have a lot of other things that go along with it, and it does drive up the costs. So if we're going to have an honest conversation to the questioner's initial question, we have to look at what is regulation doing to the cost that is really shutting a lot of people out of the market. I don't necessarily agree that the government has to write another check to cover this. I think that we have to look at what has the government done to drive the cost up.
Do you? I know this question's been around some. we've had it in previous programs, and I'm wondering if you've had any experience with this. Have people specifically identified regulations that are concerning? I can tell you that from my old days as a city attorney, I had some issues with the Department of Health with regard to hospital regulations about where you know railings go and things like that. But I'm just wondering in the daycare setting, if do you have any thoughts on specific issues that have come up in your conversations with people about these issues?
Yeah, and if, I wish that I would have known the question was coming because I do have some notes, but
Right.
they're at
It's not.
home.
I
And I had told you earlier that I don't feel like I can do video from home because my cats Moose and Mowgli decide to jump in front of the computer and they blow the entire interview up. But I think that it's worth all of us to sit down and have a conversation and recognize that uh, varying types of regulation do drive costs. And let's measure them. Let's measure the things that we're requiring providers to do. And maybe every now and then we'll be able to have the frank conversation amongst ourselves that maybe this regulation isn't having the desired impact, and we back it off. So
Barry,
Senator Housley, your thoughts? Well, go ahead. I'm sorry. Go ahead, Representative Long. Do you have something to add to that?
I'll be real brief. One of the things that folks have sometimes raised to me who brought up this question is we have ratios of the number of early childhood teachers that need to be in a specific classroom with kids. And so it's been raised, well, that adds costs. And it certainly does, but it's also there for a good reason, which is that you want to make sure you have a safe classroom where you have the ability to, take care of the infants who are in that room, take care of the young kids. So the regulations that we have in place aren't there for no reason. They're there for important reasons. And so certainly open to the discussion, but I think we have to realize that we have some of our most valuable young people in the state in these settings, and we need to be thoughtful about how we're protecting them too.
That's your thoughts. Daycare regulations, daycare costs, etc.
Yeah, I had the privilege of being the chair of the um, long-term care and aging and family care committee. And so we did a lot of work with the child care, both the centers and the in-home daycare providers, um, and being able to listen to all of them and what their concerns are. And regulations is a big deal, especially if you're in greater Minnesota. A lot of them have now just closed up shop. This was even before COVID, and now after COVID, it's there's even that much fewer. And that's the number one issue is from coming from our Chamber of Commerce is they need workers, but people can't go to work if they don't have daycare. So doing what we can for our, and especially in greater Minnesota, there is such a need for more daycare providers. And regulations is what caused a lot of them to quit. Um, I don't remember the specifics like you were talking, Representative Nash. But when it comes to the county inspector coming to the in-home daycare provider and issuing them a bunch of violations, when instead could you just give them some warnings and allow them to fix it immediately? So they feel this huge weight all the time when they're going to get this surprise visit, and they're not huge violations. Just educate them on the spot, get them to fix it if it's not that much of a safety hazard. If it's not a safety hazard, just get them to fix it on the spot. I do know, and this does worry me, back when the Democrats had both the House and the Senate and Governor Dayton at the time, they were trying to force, the Democrats had a bill to require all of our in-home family daycare providers to unionize. That was, we, on the Senate floor, maybe you remember it, Barry, it's a record for the Senate. We debated that all night long to really stick up for our in-home daycare providers. So just in whatever bills come before us, I do hope that they have all stakeholders at the table. And again, getting bipartisan support and listening to everybody before anything does cross that finish line is what I'm hoping for.
Senator Murphy, we finally get to you. Let's talk a little bit about daycare issues, daycare regulation, supporting daycare providers. The floor is yours.
Thank you, Barry. I think if if you've been doing this for 33 years, I bet many of those 33 years you have been talking about childcare.
This
This
is
is
not the
not a
first
new
time we've had the
problem.
question. I would agree.
That's right. And I think we've admired the problem for a long time. I have been among those who have looked at the issue of regulation, and I chose the profession of nursing, not because I wanted to do paperwork, but because I wanted to take care of people. And yet, the documentation that is a part of nursing is really important to make sure that we're meeting standards, et cetera. So there is a role for regulation. I'm with everybody else in this group. If we can take a look at that and ease that burden and maintain high quality and safety, I'm all for it. But I don't think that is the fundamental problem. And I was also in the legislature when we took this issue up a decade ago, and we didn't pass a bill to require unionization. We passed a bill that would allow child care workers to organize and unionize if they chose to, which they rejected. Senator Housley and I worked together last year with a group of frontline workers, including child care providers, who did incredible work during the course of the pandemic. And one of the things that sticks with me after these last couple of years is the fact that it is home care workers and nursing home workers and child care workers, the people who are caring for our loved ones, that make such low wages that we can't keep the workforce in place. And that's a real problem for communities all across the state, and it impacts the workforce, it impacts employers, it impacts our ability to work and support our families and our livelihoods. So it's a real issue. Obviously, we all know that. And I do think a sustainable funding mechanism is the answer to this question. If we want to make sure that people who are doing this work are highly prepared, they're well trained, and they're well compensated.
We will have an opportunity to discuss this issue again in the weeks ahead. Let's move on to another question.